It'll only probably take 30 to maybe 40 minutes tops, so feel free to ask questions. We should have plenty of time to get them all covered before we hit the top of the hour. Maybe for lack of a better term, we've created what we call a one-stop shop. We've brought our claims edit tool, our remit posting, our analytics tool, and also patient eligibility. It's called verification up there on the tab. We brought all those optional services all to one website for you, and then we've allowed some of those databases to talk to each other to really create a interactive kind of analytic approach for claims follow-up. So real quick, I'll just kind of go through the screen on the home page here as how it's laid out, and then we'll kind of jump into the claims portion to start with. But as we kind of go from the upper right, first thing, we've created a panel there where we can push out kind of nationally regulated type information that, just like, you know, we're showing ICD-10 there as our example. You know, that was a big play back when the flip over from ICD-9 to 10 was happening. Put a lot of information in like that. So as there's you know, industry type changes coming forward that we feel that would be appropriate information for folks to get access to, we could push that information out to you. Underneath that panel, we've got a box built called Product News. It's how we're going to, or how we can use the tool to better, I guess, empower you to know what's available to you. So, for example, one of the new features that we're getting ready to roll out with this product is an estimation product that will allow you to not only, you know, tell the patient your copay today is X, but based off of what procedures that you're going to actually perform on the patient and their eligibility response back from the payer, you'll be able to, with that tool, give them an estimate based off of, you know, your charge master, their payer contract, their current eligibility, even their current deductible met year to date, and be able to provide them a hard paper copy of, here's what we think your out-of-pocket is going to be for today's procedure. So, and that patient estimation piece is rolling out sometime in June. I mean, we're beta testing it now. It's live with some sites, and we've rolled it out to the sales team. So that's something that's coming down the pipe, and that's where we'll use this product news area. So you'll see that change from time to time as, you know, there's new functionality available. The way that we built that is we put like a marketing tab in there, but then we've allowed, if it's something that's of interest to you, you can click and drill in and get more details. Even some of the functions, we've attached videos where you can see how the product would work and that type of thing. So hopefully some self-help to introduce you to, you know, additional functionality as we move forward with the product. The next screen, this is our alerts and notification. This is how we push information out about your payers. Might be the payers got some scheduled maintenance. It could be anything pertinent to, you know, the payers that you work with. We built this where you've got the ability to go in and you can look at all the alerts within the last month. You can go in and do a date search. You can do a search off the title. You can do a search, you know, off that specific payers. If you want to see all the alerts for, let's say, Aetna, you could go in and do that. Or if you want to see the alerts for Aetna, you know, all of last week, you could go in and sort it that way as well. So it just gives you a way to drill in to specific information about your payers without having to go through, you know, the entire, this could be, you know, scrolling for the last month of payer updates. Next thing I want to talk about is really jumping into how you would actually work a claim within the tool. But before I do that, let's talk about how on the screen. So on the home page, work list, that's one way to if you want to get in to you know, work your claims, you can go to the work list. You can also go down to the navigation that's here on the left-hand column. But before we jump into any of that, I want to talk about how we're responding or presenting the claim information back to you. What we've done is, first, we've built some edits that look at the claim as it's coming into our tool prior to sending it over to the clearinghouse, determining, is this claim going to be accepted at the clearinghouse? If there's an issue with it, it's going to fall into this red bucket called rejected. It's not a claim that was denied at the payer. It's just a claim that we know is not going to be accepted at the clearinghouse. And we'll show you an example of that here in a second. But that's one follow-up opportunity, because we're looking at claims before we send them to the clearinghouse and giving you the ability to make that correction. Another bucket would be rejected claims. And those are claims that have made it through the edits. They went to the clearinghouse. Now they went to the payer. For some reason, that claim was denied. Excuse me, I'm talking about denied claims. So a claim that's gone to the payer would be a denied claim if for some reason they've chosen not to pay that. A warning, what we're doing here with claims that fall in the warning bucket, this is really where we're proactively trying to help you with claims follow-up. So what we're doing with our analytics tool, and like I said, we've got a whole array of tools that kind of work together. With our analytics tool, we're capturing data based off of claims to specific payers. So based on the payers that we've set up for you, we'll track historical data, such as we know that a claim should leave the clearinghouse within X number of hours/days. We know going to payer, let's say, X, that we should get a status update within 48 hours of leaving the clearinghouse. That's the type of information we're looking at, and we're building thresholds based on historicals. When you have a claim or claims that fall outside those thresholds, then it falls into the warning category. Doesn't mean the claim is going to be denied. It just means for some reason that claim is taking longer to go through the normal process than it should. So instead of looking at all your outstanding claims and drilling down by largest dollar amount or oldest claim, here what we're doing is we're looking at the particulars for the individual claims and saying, based off of the information that we've received from the payer so far or from the clearinghouse, this is a claim you probably want to look at. And then there's a way when you drill into the claim that it's actually going to show you where the holdup is at. So you're not calling the payer for a claim that's still in the clearinghouse and that type of thing. Another category that a claim could fall in is an incomplete claim. This would be a claim that you can manually enter a claim into the tool. This is, for the most part, what we find in the incomplete category is a claim that someone started to manually create and didn't finish it. So it's setting in a bucket for them to go in and work later and finish that claim out. And then the last bucket that you can use is follow-up. So you can go in to the claims that were rejected or in the warning category, and you can set follow-up dates to go back in tomorrow off of your work list that you created in follow-up, and see if that claim is still have an outstanding status, or is it moved into good standing. The claims in the good standing category are exactly that, and you can see we use the stoplight approach here. Green, of course, is good. Red is bad. Anything in between red and green is going to be, kind of a caution, some type of an issue. So instead of looking at all your claims, these ones in good standing doesn't mean they've been paid, doesn't mean remits have been received yet, but it means those claims are all within the thresholds. So instead of calling on your large dollar claims that haven't been paid yet that might be well within the thresholds, here we're trying to help you target the specific claims that need follow-up. The way to jump in and actually work one of those claims, we'll just go into the rejected category. It's going to bring up, for demo purposes, we've mocked up, I think, 10 claims here, but it's going to bring up these claims that for some reason were rejected based off the edits that we built to send to the clearinghouse. So let's open up the first claim, and it's going to tell us, what the actual error or edit issue is that needs to be addressed. From there, it'll take you straight to the area. Here it's saying that the state identifier was left blank. What you can do here, you can manually correct that, or you can go back into your claim system, fix it there, and resubmit the claim to us. If you fix it here, we have built a validate and submit option. So like if you put in, let's say, CA for California, and I'm not going to do it because we're on the demo site, but if you put in a CA for California, and that was the appropriate state code, you hit validate, it's actually going to run that claim through all those edits again that it ran the first time. If it passes with no issues, then you can take it straight to submit and submit it straight to the clearinghouse. If you decide, no, I don't want to work the claim in this tool, I want to work the claim in my claims management system or my billing system, you can do that, resubmit the claim to us, and if it doesn't have an issue, it'll go straight to the payer. If it does have an issue, it'll fall back in that reject button, and then you'll bucket and you'll work just like we're looking at it here. From here, you can also look at some claim detail. I'll just open the summary real quick. We'll go to a better screen later where her claim has kind of made it upstream farther. But this is showing you, I talked about that analytical tool that we have that'll tell us if a claim has an issue. Here it's saying, the claim was submitted properly, so you sent it over to us, we received it, but it never made it to the clearinghouse, and that's why it was in that bucket. For a claim that made it out of the clearinghouse over to the payer, but for some reason it's past the date and time that we felt we should have a status, it'll have the indicator out here. So it's really pointing you on where you need to follow up for that specific claim. We're also providing the claim detail as well as the service line details with each one of those claims that's submitted as well. So if you need that type of data, it's available for you. Also within the tool, you have the ability to create a claim, or we showed how you could actually search for a claim. You could go in individually, because we pulled that off the pie chart. If you wanted to look for a specific claim, you can do that. You just go in and put in the particulars, and it's going to bring up all the claims that match the search criteria that you've entered. You can also create a claim, and you can create professional or institutional. So 1500s and UVs can both be processed through the tool. If you're exclusively 1500s, that's fine. But if you do have those one-offs at times where you have a UV, you can go in here and actually create that institutional claim yourself, basically a manual claim, or you can submit them. You can submit UVs and 1500s both, electronically to the tool, and we can process them both. They'll process the exact same way as I've shown you before with the pie chart and the follow-up detail. Go through my notes, make sure I'm covering everything so we. Yeah, now we want to, that covers kind of how to track a claim, how to follow up on a claim. Now let's talk about remit information. So when the remits come back, and we are going to look for payers that maybe today you're not set up to electronically get the remit, the payment file back, but if we have connectivity to that payer, we will notify you that that's an opportunity to get electronic remits, and that really helps us, enables us to do more of that tracking, posting back, provide the information quicker, and that type of thing if you can't connect to as many payers electronically as possible. So we open up the remit tab. Excuse me. Again, you can search for a specific remit, or if you want to run a list of certain remits that you've received on for a excuse me, a certain patient. If you want to look at the account number, you can see the data there that is required to do a search. I'm just going to pull up, for demo purposes, I'm going to just pull up a remit to be able to show you. So let's just look at this first one, I think. Okay, so we pull up a remit. It's going to show the remit details. It's also going to show any adjustments that might have occurred on that account. It's also going to allow you to re-queue this remit information. So if we're pushing this back so you can auto post, and maybe you don't want to post it until you get notification from the bank that the funds have actually been received. So we'll keep this data within the tool, but then you can re-queue that as far as pushing that back into your system when you want to post it back, or you can post it back when we're updating the data as well. So it gives you really two options on how you can post the data back into the system. We also have Data Viewer. You're going to see that button available on several screens. What we're doing here is we're giving you the electronic information that actually came back. Here, for example, this is the information that came back within that remit. So if you're talking to the payer and they have a question, or you have a question, this is going to allow you to actually get back into the actual remit information. Back out of here. So you have the ability to look at the actual data that was submitted electronically. Here you're going to see it in human readable format. Down here it's going to show the line item paid, as far as each amount that was paid per line item, so you can drill into that as well. It's also tied to the claim. If you saw that on the previous screen before I clicked that, you can actually drill straight back into the claim. From here you can also print out an EOB if you need maybe you've got a secondary claim that you want to process for this patient and you need the EOB from this payment or from this electronic payment file to be able to post or attach to that claim file. You can create that EOB from here, print it out, and there you go. Today we don't have electronic secondary claims processing, but that is something that we're actively working on. So hopefully in the next not too distant future, when you go to the home screen and you look down in the lower right, maybe secondary claims might be a feature that will be available. But just for an example of how we would use that marketing piece. From here, you looked at the remit, you see that it was paid. Actually, in this one, it wasn't paid. It was rejected because you can see the adjustment information. And from here, you can actually go to the claim detail. Here, you're going to see where the issue, just like I talked about earlier, this was denied at the payer. So as far as follow-up, those type of things, you'd want to contact the, the payer to discuss in detail what exactly is wrong with that claim, and then hopefully correct it and resubmit and be reimbursed for that. The next option after we move past the remit tab are reports. Reports, a lot of our clients that have used this tool is relatively new. This tool was rolled out maybe 12 months ago in its kind of infancy form. It's been enhanced since then. But almost to 100% of the clients that are using this very seldom go to the report tab. The reports allow you to basically to use reports for your follow-up tool. And you can go through and you can pull all your denied claims or all of your remits and those type of things. But we're going to be able to, within especially the home page, looking at that graphic, especially for follow-up detail, you shouldn't have to go run reports for follow-up. I know we find a lot of our clients will run a report on all their outstanding claims, and then they'll sort it highest dollar first, and those are the ones they call on. And you can do that, and this report generator will allow you to do that. But if you go back to the pie chart with our analytics tool, hopefully you'll have a way to drill into those claims and really identify which ones might be the problem children that you really want to focus on versus claims that might just be in the normal process of being paid. Payer tools. Here's where it gives you the ability to enroll, to set up your payers. This is real important for really two data points that we use from here. One, we go to the payer sites for that status update information. So we're not waiting on a payer to send us like a 277 status report. We're actually actively going to their websites to find out information on those claims. So we need access to their website to do that. We also, if you choose to use this tool for eligibility verification, we're going to the websites for that as well. Especially with both eligibility and the status updates, we found you get much, and especially on the eligibility side, greater details from going to the websites versus just pulling back a standard 271 eligibility transaction. A lot of times we can now bring back not just deductible on the plan, but the deductible remaining or the deductible met year to date, and then do the math and you can figure out what the patient still owes. That really enables us or helps us when we're doing the estimate, because in today's world with all the high deductible plans, if somebody's got a $5,000 deductible, whether they've met it or not is a big factor in what their out-of-pocket is going to be for a certain procedure. So really look for that, and that allows us to pull that data from the payers that will put it on their sites, and that's that credential management tab. That's really what we're doing there, is we're going in and we're storing the authentication information that gives us, or gives you, I guess, access to that specific payer's website. So on your behalf, we're going out to their website, checking eligibility, checking on the claims, and bringing that data back. Analytics. This is the tool that we're using to really feed the pie chart, but it's also a tool that you can use to drill down even more than just claims follow-up for the specific claims that you have outstanding. What it'll allow you to do, it looks at categories of how long it's taking you to submit the claim, how long it's taking the claim to get paid. Just give it a couple seconds here to open up. But it allows you to drill down at different, let's say, parent-child type relationships. So we've got some of our clients that have multiple physician sites within their, let's say, client base, and then maybe those physician sites even have multiple folks within an individual site that might be submitting the claims. It allows you to slice and dice if we just want to compare overall everybody that uses the tool that's within a certain subset, or if we want to look at all of our providers that are in a certain state, we can do it by specialty. The demo sites, the data is not going to change because it's got limited data in here, but if in the real environment, you'd be able to pick which one of these different submitter IDs, and the submitter ID is actually an individual office, and you'd be able to go within that office and then look at the individuals that actually submit claims and be able to compare types, different pieces of data. And what we're looking at here, we're looking at total claims turnaround. That's the one at the top. So here we can see from March to April, it's now taken us almost 5 days longer on average for our claims to get paid. Here we're looking where and then again, we've used the stoplight approach. So hopefully, and at an eye's glance, it's going to take you to probably where your problem children are located. So here we can say overall we have an issue because, we've got 5 more days that we're not getting revenue in on average than what we had last month. So we've got to stop that trend. So we look down here and we say, well, it looks like the issue is on submitting the claim. Remittance might be an issue. It's kind of in that category where it's turning yellow. So from month to month, and let's look at it total dollars, but from month to month it's got down, but that would make sense if it's taken us additional 5 days to get paid. That probably that 5-day float is what's causing that 16% drop. But it looks like our issue here is average time to submit. And then from there you can go in and it'll drill a graph that'll even take it all the way down to the individual, so you can see who's the problem child there. You can look in at claim dollars to see if that's the issue. And here it's bringing back the providers for March and like your top payers and those type of things. So it allows you to drill in to see where the dollars are coming from, how that's changed. It'll also look at days. We don't have that graph built into the demo site yet, but it'll look at days, and you can drill in and see who's actually creating that issue as far as the claims, taking an average of 5 additional days for the claim to be submitted to the payer. So it allows you to really get into down into the weeds as far as issues that have been diagnosed. Maybe from the top line you see that our dollars are starting to drop on our total remits, and we know that there's a reason for that. We're not for sure what it is, but here we can see it's taken longer for the claims to turn, and then real quick here you see it's on the front end, and then it allows you to drill in. If it was on the payer side, you could drill in. We don't have any of the reports there on the payer side, but you could drill in and you could see actually which payers are taking longer this month compared to last month, and use that to, especially if you've got contracts established with timelines for payment by those providers, you'll be able to go in and renegotiate with those payers based on the variance that it's causing because they're taking longer to pay you. Also, another opportunity here, I talked about the ERAs. Here we'll attach any payers that we see that you're using that we have connectivity to electronically to get those remits back in electronically that maybe today you're not taking advantage of. And we'll make that available to you, bring it out here on the reports tab where you have access to it, and we'll help you get that connectivity set up, because it really allows us to bring more data into the reporting structure, allows us to add that remit to the claims. You can create the EOB off of it. If it's a paper remit, we don't have access to it. So we're going to suggest any payers that we see claims going to that we're not receiving remits back. We're going to suggest that if we have connectivity, that you look at that and consider allowing us to receive that remit information electronically. So that's our analytics piece. The nice thing about this tool is it's sold as a bundle, but you can also pick and choose which pieces fit your specific needs. So one physician practice may say we really need an eligibility tool. Another one may say we want something where we can see our claims and remits together, or we really like the analytics tool, or maybe if it's a large practice with multiple offices and you want the analytics tool set up so that large practice can look at it as a whole but also drill individually. So you run it almost as a, I guess, a main business office. So there's a lot of ways we can set the tool up. You just let us know which of these options would make the most, I guess, give you the most bang for the buck, and that's how we can roll the tool out. Under the validation or verification piece, you can see a couple buttons. One, the last two really talk about the estimate piece, which I've mentioned that a couple times. That's the new piece we're going to be rolling out in June, so I can't really show it to you yet, but it is in, like I said, it's in beta. It will be available within, knock on wood, the next 30 days, hopefully even sooner than that, but that'll allow you, when the patient comes in and you do an eligibility check, when you add in the services that you're going to provide or that you plan to provide that day, it'll go into our database that we've stored based off of working with you, and look at their payer contract, do all the allowable adjustments and those type things, look at their copays and deductible information, and actually give you the ability to print out a accurate estimate based off of what they're coming in for. Here's what they should expect to pay out of pocket, and then you can work the financial discussion from there. But it's going to give you a automated, streamlined tool that will quickly provide a defendable estimate based on the payer contracts that we have on file for you. As far as eligibility, another thing I mentioned when we were talking about setting up the payers is we go to the payer websites for eligibility. We found that it's quicker. The payers are not down near as often. I mean, the websites are usually up. A lot of times that 271 report's unavailable, so you get payer not available. Going to the website eliminates, shouldn't say totally eliminates that, but greatly eliminates that issue. It also allows us to bring back a lot more data. Typically, it's more up to date, having information like deductible met and those type things. Show you real quick, if you wanted to do an eligibility check, here's the type of information that you would put in. You have the ability to drill down too, because we're going after their websites and we're looking for an array of criteria. But if you only want a certain amount of that data brought back, now the standard default is the Healthcare 30 code, which is kind of the general healthcare insurance coverage. But if you're a outpatient center that provides a real specialty type service, maybe there's one type of coverage that you want us to specifically drill into. So you can check that, and that's the only response you're going to get back. Even though we're getting the whole response, we're tapering it down to just what you asked for. That way you don't have to scroll through a large amount of data to find specifically what you're checking the eligibility for. We go into an actual eligibility response to show you what they look like. So I'll go into the database, and we can go in and search based off of previous, and we keep this data. online for 6 months. So if a patient comes in, they say, I was just here last week, coverage hasn't changed, you can just go in and search and find that eligibility response. On the claims data, claims and remits, we keep that within the tool for 4 years, and then we back it up for 3 years. So you have real-time access via the web for 4 years, and then after that we move it to cold storage, and you have an additional 3. So you have 7 years for the claims and remit data, 6 months on the eligibility data. So let's go ahead and search, and let's see, who do we want to pick? Let's just pick Jones. These are successful eligibility responses that have come back, and what you're going to see is we have the ability to bring back certain views. Again, it's the way to allow you to streamline. Here we did the standard 30 coverage is what we returned. But as far as, again, instead of looking at that entire eligibility response that came back, then we wanted to see in this example the co-insurance. If you only wanted to see the copay, you can bring that up. If it's a Medicare patient, a lot of our customers that use the tool, if their predominant payer base is Medicare, then they'll have it Medicare as the default. So when the eligibility response comes up, it brings Medicare information to the top. So you have the ability to drill down with multiple views. You also have the ability to target in the very beginning for specific coverage. So there's really 2 ways to drill down, so you don't have page after page of information to sort through if you're just trying to find, do they have a copay today, or do they have a deductible premium, that type of thing. All the information is still there in the background. We're just giving you ways to drill into it, so you don't have to look through or wade through all of the information that came back. Also bringing back the demographic information that they have on file. So here you're going to see this is what we received off of the claim or off of the eligibility request that came in. This is what the payer has on file. So you'll be able to compare address, that type of information from the payer versus what you have in your system as well. The only other thing I really had on my list to make sure is covered is the estimation piece, which we've already talked about, and don't have that. Actually, I don't know if we built that into the demo yet or not, but I can open it up and see. But the estimation piece is doesn't look like it. That's a piece that we're building out as we speak. Like I said, it's already in beta. We'll be rolling that out very quickly, and we'll probably, I'm going to say, have an opportunity for folks to watch another webinar in the near future that'll show that enhancement as well. And with that, I will open it up to questions and see what we can discuss and talk about from this point.